As the United States has become the country with the most cases of coronavirus in the world, it has also laid bare the flaws in our healthcare system that have left us ill-prepared to fight a global pandemic. With millions of Americans now unemployed, the healthcare system being pushed to its limit, and tens of thousands of deaths in the United States alone, people have begun to warm to ideas that were once seen as unthinkable. Specifically, Americans have begun to think twice about universal healthcare. A study reported on March 13th found that 41% of Americans are more likely to support universal health care in the wake of the coronavirus. This comes as countries with strong public healthcare systems like Germany, South Korea, and even Canada have handled the virus much better than the United States. Through their public healthcare systems, these countries have been able to better coordinate their responses to the coronavirus. Germany, thanks to a strong public healthcare system, along with comprehensive testing and social distancing measures, has had one of the lowest death rates. Korea, through a similarly effective response, never even went on lockdown and flattened the curve. The United States' response to COVID-19, on the other hand, has been incoherent at best, as private hospitals have neither the resources nor the obligation to work with the government. What's more, many Americans are dependent on their jobs for healthcare, so they have no healthcare whatsoever if their job lays them off due to the virus. This further hinders the response as it makes Americans reluctant to go to the hospital in fear of the cost. While the Trump administration has since passed legislation making testing free, treatment is still not. This has arguably long been a problem with America's healthcare system, especially in times of economic downturns, though the coronavirus has exacerbated it. Further, the lack of a unified healthcare system to manage the response has led to states competing for resources. Opponents of universal healthcare may point out that Italy has failed to contain the virus, despite having universal healthcare. Though as the nation recently reported, Italy's healthcare system has actually struggled because its healthcare has been becoming more like America's. Decades of privatization and spending cuts, combined with cuts to social security and education, have left Italians more vulnerable to a pandemic than ever before. To be fair, the age demographics of Italy, along with the population density and a pretty shaky government response to the virus at first, didn't help. All in all, it's pretty crazy to think that it's taken a global pandemic to show the American public the importance of universal healthcare.